Again, good afternoon and good evening to all of you. Uh, for this afternoon's session or our synchronous session, we will have the primarily our self-assessment exercises, which is related to the chain or the topic that we have discussed last time, which is the chain of infection. I may need maximum participation. We are 41, okay? We are 41 in this room, hoping for the maximum participation. Okay, so let's proceed with the first question. So probably if we are 41, at least we may have 25. Okay, 25 of the students who may participate, at least 25, but more than 25 would be very much appreciated. The maximum participation that we may have, the better. And it could be best if it is all. Okay, the nurse attends rather to a client who is confirmed with typhoid fever after diagnostic evaluation. He is considered as a carrier. Will it be infectious agent? Will it be reservoir? Will it be portal of exit or mode of transmission? Again, the nurse attends to a client who is confirmed with typhoid fever after diagnostic evaluation. He is now considered as a carrier. Letter A, infectious agent. Letter B, reservoir. Letter C, portal of exit. Or letter D, mode of transmission. So we are now 16 in the loop. And I think I asked for at least 25. So I'll start counting. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. So thank you very much for the 27 response out of the supposedly 25 expected or requested for the response. So I may ask those who have raised their hand. For those who have raised their hand, may I call on Miss Tricia? Tricia Cipriano, what is your answer?
B po, reservoir.
Okay, reservoir. Okay, letter B, reservoir. So I thank you so much, Miss Tricia. I may ask also other students to respond, those who raised their hand. How about Miss Angel? Angel Garcia? Angel, what is your answer? Miss Angel, if you have difficulty with your audio, you can type in the chat box. Miss Angel. Okay. So so I have received an answer. So your answer is letter B also. Thank you. How about another student? May I call on Jansen? Jansen, what is your answer in the question?
Forbidden pudding.
Letter B. Thank you. So the three of you answered letter B. So let us reveal the answer. So the answer is letter B. Correct. So you may now lower your hand. So let us have the explanation. When we talk about the confirmation or situations that a client is already confirmed, meaning it is on the level of the infectious agent if the cause or the pathogen is not yet identified. But if it is already identified in the question that you may encounter that it's already confirmed, then we'll consider the person as a carrier or the animal or anything that can be considered where or the place where the infectious agent lives and multiply. So it's not definitely infectious agent. For portal of exit, this is on how the infectious agent or the causative agent uh, will be away or will be leaving the reservoir. So it could be through the coughing, the sneezing, secretions, okay? Any bodily secretions coming from the reservoir. It could be saliva, it could be a droplet, it could be blood. So anything coming from the reservoir is portal of exit. And the mode of transmission is on how, from the portal of exit, the mode of transmission is on how it will be transmitted to a new host, but prior to the portal of entry. So the answer is reservoir. So next question. Okay, so let's have a higher number. So may have 28, okay, 28 among the 40 students that we may have. The nurse assists the client who is already confirmed with rabies infection and concluded possibly of infected secretions, okay? try to check the keywords that you may have in the question, ha? So it could be infectious agent, reservoir, portal of exit, or mode of transmission. Again, I may need 20, what did I mention? 26, I think. 26 or 28? 26. So I may need 26 participants. Students, raising your hands will definitely give me the confidence that you know the answer and you have learned those concepts that we discussed last time. So again, the question is, the nurse assessed the client who is already confirmed with rabies infection and concluded possibly of infected secretions. Okay. So infectious agent, reservoir, portal of exit, mode of transmission. So I may need 26 and I'll count now. Okay, time, buzzer beater. 26, it's 10, 9, 8, 7, more than that, 6, 5, 4, 3, 2, 1. Okay, very good. We have 30, 29. Okay. So I may ask those students who have raised their hand. So I may ask po uh, Thea Gakad. Miss Thea, what is your answer? Miss Thea, if you have difficulties in your audio, you may... Okay. Your answer is letter A. Okay, let's ask the others. Thank you very much. How about Miss Jem? Jem De La Rosa, what is your answer to the question?
C po.
Letter C, portal of exit. And one more. I'll ask those who raise the hand. How about Claire? Claire?
Letter A po.
Letter A. Okay, thank you very much. So you may now lower your hands. Two of you answered, if I'm not mistaken, two of you answered A, infectious agent, and one is portal of exit. Okay, now, when we talk about infectious agent, again, as what I have told you, infectious agent or causative agent could be still on a perspective that it is not yet within a reservoir. So, meaning, if it used already confirmed, then ibig sabihin, the individual already undergone a specific test, confirmatory test, and diagnosed with rabies infection. So pumapasok na ngayon specifically on the reservoir. But since it added, concluded possibly of infected secretion. So the secretions itself, okay, the secretions itself is consideration of the answer. I think one of you had the correct answer. The answer is portal of exit. Okay, the portal of exit. So why do we mean by why the answer is portal of exit? Because as what I've told you, the infected secretions are those that may justify or validate that the the rabies virus or rabid virus, the rhabdovirus can be out of the reservoir through uninfected secretions. Okay, I hope everyone had been enlightened. So let us proceed with the next question. We are still 40. We may have 23. Okay, 23 at least. Later I'll have I will request a higher number. The nurse attends to a client with leptospirosis. From the patient's history, the client revealed the exposure of open wound in a flood. It refers to portal of entry, susceptible host, infectious agent, portal of exit. So we may need 22 student participants. Go. So the nurse attends to a client with leptospirosis from the patient's history. The client revealed the exposure of open wound in a flood and it refers to. So we have reached 23, 24, higher. So probably 25 students knew. So this could be also my level of confidence that 27 students knew the answer. So thank you very much. Out of the 22, we have 27. So probably I may be calling those who did not raise the hand just to wake up the neurotransmitters. Okay. So can I call on, may I call on Nathan?
Yes,
Johnny?
sir.
Yes, what is your answer?
A po.
Letter?
A po, portal of entry.
Portal of entry. Okay, thank you very much. I'll be calling the others. May I call on how about Eliza Lubian? Eliza? Eliza? Eliza. Okay, so let's call the other two. Yeah, Miss Eliza, good afternoon. What is your answer?
Letter C po.
Letter C, infectious agent. Okay, let us now. So the two of the students that I have called have different answers. So may I call on, how about Luis? Luis? Luis and Ubongin.
Yes po, sir.
Yes, what could be your answer to the question?
Is it letter A?
Okay, letter A. Okay, thank you so much, Mr. Ubongin. So we have two students who have answered letter A and one answered letter C. Let us now analyze the question, ha? The nurse attends to a client with leptospirosis. With leptospirosis, meaning with the patient already have. So we will get out of the infectious agent already. So from the patient's history, the client revealed the exposure of open wound in a blood. Okay. So actually, when we talk about the leptospirosis, the infectious agent is the leptospira. The reservoir are the rats, infected rats. The portal of exit are infected urine of rats. And mode of transmission could be direct. Okay, direct transmission. Direct transmission via the transfer to the at papasok na dito ngayon yung open wound. So yung open wound ngayon could be the portal of, let us reveal the answer. Two of you I actually answered, but the answer is portal of entry. Okay, why it's not susceptible host? If the person already manifested one of the signs of leptospirosis, then it could be susceptible host. So those are the host, new host na kasi to new host na ito na they are being considered na as new carrier. Unless if the person was confirmed already with one symptom, papasok na ulit yan sa infectious agent, then reservoir ulit. Kasi the leptospira already invaded the physiological processes of the person. So that's portal of entry. So the complication for leptospirosis are definitely kidney problems. So that's why most of the patients with leptospirosis are admitted in the National Kidney and Transplant Institute. Next po, the nurse sends the client to isolation room. For the meantime, we are 40. Okay? So higher tayo at least 30. Okay, 30. I will be glad if you will respond. The nurse sends the client to isolation room after definitive test of COVID-19 infection. Transmission is concluded when contacted with infected secretion. Direct transmission, indirect transmission, droplet transmission, airborne transmission. This talks about the COVID-19 infection. The transmission is concluded when contacted with infected secretions. Okay, infected secretions. So I may need, so we're still 15 and I may need at least 30. Okay, 30 students. I hope you know the answer. So I'll start counting now. 10, 9, 8, 7, 6, 5, 4, 3, 2. So we're 27, 2. 1. Any more? 2. Oop. 2 more. 2, 1, 0. Okay, thank you very much for those 28 students who have the courage to and confidence to have an attempt to answer the question. So probably with the 28 participants, so to acknowledge naman the efforts of the 28 participants, very close to the 30, I'll be calling those who have raised the hand. So I will be calling those who have raised the hand. Let us call on Leonard. Leonard, what is your answer?
Droplet po ba, Doc?
Droplet, letter C. Thank you so much. I may be calling another two. How about Jasmine Cruz? Mary Jasmine?
C din po.
Letter C. Okay, one more. So two answers, two answers from the two students are the same. May I call on, how about Miss Samantha? Samantha Añasco.
Droplet po.
Okay, so let's see. The three of you, thank you so much. The three of you answered droplet transmission. So let us check if your answer is correct. So the answer is droplet transmission. Okay, sir, why isn't it not direct transmission? Kasi if COVID-19 are obviously caused by the transmission of infected secretions via droplet. So there are few studies naman that it's by airborne transmission. But moreover, the literature says that it's more on the droplet transmission. However, sir, why it's not direct transmission? Kasi pag direct transmission is the close physical contact. The close physical contact, for example, the person have done kissing, for example, have done kissing. So that's a direct transmission, the direct physical contact. Sexual intercourse, that's a direct physical contact. Blood transfusion, so definitely that's a direct transmission because direct to the circulation. For the indirect transmission, this could be through a contaminated object. Yan, pag indirect transmission, contaminated, ibig sabihin, di ba kung for example, droplet yung sa portal of exit from the reservoir, tapos again, use of utensils from the objects that are personal for personal use of the person who had the COVID-19. So this could be indirect transmission. So the airborne is if the virus as it suspends through the air. So most probably COVID-19 infection are from droplet transmission because we all know that how many hours did we mention that the virus can live for almost 12 hours. Okay, can you imagine that? Can live almost 12 hours in an object. So this is very important information that we must do. Okay, next question. Now we are now 42, so we added one student. So out of the 41 students, sige, I may request at least again 30. Okay, 30. So the nurse attends to contact tracing. The community could be high risk of being infected. To break the chain, so we are now talking how to break the chain. To break the chain, measures can be done except, just a reminder whenever you will encounter questions in the board exam, always take into consideration, don't you must be reminded that the except is a very powerful very powerful direction kasi it means that you will be choosing the incorrect statement. Okay? So what is the key word, the key terms or the key concepts that you may have in the question? The person is doing contact tracing, the community is on high risk of infection. So how to break the chain? Except A, diagnosis, B, antimicrobial stewardship, C, definitive testing, letter D, sterilization. The nurse attends to contact tracing. The community could be high risk of being infected. To break the chain, measures can be done except. So we may need 30. So anyone, please raise your hand. Okay, we have already 2. So at least we have 30. The nurse attends to contact tracing. The community could be high risk of being infected. To break the chain, measures can be done except. Measures can be done except. So 9, 12 out of 30, 14, 15, 16. So does it mean that if we have low turnout of those who raise the hand, the question is difficult? Let's see. So out of the 30, we still have 9, and let's start the counting. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Okay, so out of the 30, we have 20 who have attempted to raise the hand and ask questions. So I really appreciate the 20 participants because it seems that the question is difficult. So but they still parang have the confidence to try answering the question. So I will be calling those who have raised their hand. So probably I may be calling Harold. Harold Buen Consejo, what is your answer?
Letter A po din, diagnosis.
Diagnosis, ha? Remember, ha? Except, ha? Except. Okay, thank you very much, Harold. How about for the others po? I may be calling Castro, Lewina. Castro, Lewina.
A din po din.
Answer is letter A. Okay, next po. Other one, we may call Antoinette Dairit. Antoinette?
Sir, B po.
B as in antimicrobial stewardship?
Yes po.
Okay, thank you. Thank you so much. Two of you answered except letter A, diagnosis. Okay. And one of you answered letter B. Okay. Let us reveal the answer, ha? Except. Except. So let us try to analyze again the question. The community have not identified yet the type of infection because it's stated here high risk, high risk. So to break the chain, even though they have not yet identified the type of infection, which of the measures can be done so that to facilitate the measures to break the chain? So the answer, let us reveal. Oh, sterilization. Okay, ito po ha. Class, why except sterilization? Class, remember, the community have not yet identified the type of infection. Second, is it viral or is it bacterial? So sterilization can't be uh, uh, the choice to break the chain at the level pa lang ng infectious agent. Kasi why we considered infectious agent yung level nito? Kasi the community is not yet diagnosed eh. So that's why to break the chain, diagnosis is very important. Okay? Diagnosis, because if one of the among the people in the community are diagnosed only with one infection, then probably it will observe others for having the same or similar signs and symptoms. Antimicrobial stewardship is one that may break the chain because of the term high risk, because it may depend on the doctor of what would be the prophylaxis that can be used to the individuals who have already mga signs and symptoms. Definitive testing is kung if I will be if it's not except if it is not except the correct answer here is letter C, definitive test. Kasi one that can really break the chain is definitive testing and results. Okay? So that's why it came out before yung tinatawag nating mga mass testing so that to identify how many people in the community are already infected with COVID-19. So sterilization is described as a procedure on the purpose of direction of absence of pathogen. Eh, syempre, what could be the direction? Why do we perform sterilization? Although it may facilitate absence of pathogens, but to what extent that it will be more focused? Is it viral or bacterial? Or what specific what you call this equipment, supplies, utensils, or things at home can be sterilized? Although sometimes, although this may contribute to breaking the chain, pero hindi pa siya specific if the infection is not yet identified. From the reservoir, sterilization, pwede yan. Mode of transmission, pwede ang sterilization. So it can break the chain. Okay? So next, thank you so much. Okay. Okay, for clarification, sterilization po ba ay yes, correct. Actually, sterilization can be done. Ito, I know for a fact that you have already took care of your younger mga younger siblings, or some of you took care babies or newborn. So di ba yung kanilang mga feeding bottles are being sterilized by boiling. So yon, it may lead to the absence of pathogen. Autoclaving, most probably if ito po ay the the killing of pathogens is through the extreme steaming, okay, through the autoclave. So these are the procedures that are being done sa mga sa mga operating room. Other than sterilization could be done also by soaking into a sterilization solution. So highly concentrated ito so that it will kill the pathogens totally. So those are the ways and things or measures that should be done. So since we are on the contact tracing, so the sterilization can't be applied pa. So we are identifying pa the extent of the infection that have already spread in the community. Okay, next question. Next question. The nurse attends to a client who is a carrier of hepatitis B infection. Hepatitis B is a virus. To break the chain, yan to break the chain, measures can be done. Measures can be done. Will it be diagnosis, antimicrobial stewardship, definitive testing, sterilization? Out of the 40, hoping we could have 20. Okay? So we are now increasing in number. So 7, 8, 7, 8, 7, 8. Okay? So again, the nurse attends to a client who is a carrier of hepatitis B infection. To break the chain, measures can be done. A, diagnosis. B, antimicrobial stewardship. C, definitive testing. D, sterilization. I may need 20 who are brave enough to attempt to answer the questions. Okay, so we have already reached 20 and hoping more pa ha. We must not only consider the ceiling. Thank you so much for the two students who have added with the 20. Really appreciated. So let us see ha. I may be calling those who have raised the hand. So thank you so much for the active participation and for those who raised the hand. Probably I will be calling Sophia. She did not raise the hand. Okay, probably Christian. Christian, Joshua Gong.
Sir, ano po, sir? B po, sir.
B, antimicrobial stewardship.
Apo,
Okay.
sir.
Thank you so much. So let us now call other two students. May I call on, how about Ruiz, Manuel, Francisco? Ruiz?
Letter B din.
Letter B, antimicrobial. So two of you already agreed with each other to answer letter B. How about, let us call on Ana Karaig. Ana?
Hello po. Letter C po.
Letter C. Okay. So thank you so much. Two of you answered letter B. One of you answered letter C. Let's have the analysis. The analysis now, the nurse attends to a client who is a carrier. If we say a carrier, out of the chain of infection, once a carrier is considered as a reservoir. He or she is already a reservoir, meaning the person is already a carrier of hepatitis B virus. So now, if it is viral, will antimicrobial be aligned with the breaking the chain from viral to antimicrobial? So probably on that analysis, it may not. Okay, thank you for the nice try for letter B. Some of you, one of you answered letter C, definitive testing. Okay, class, analyze the question. The client is already a carrier, meaning a person can be considered as a reservoir if proven, if already proven that the person is already infected. So meaning definitive test may not be anymore necessary because it has been emphasized in the question that the person is already a carrier of the virus. So it may not be letter C. So it could be letter A or letter D. Okay. So diagnosis. So diagnosis may not break the chain. Why? The person is already a carrier and already been diagnosed of hepatitis B infection. So the answer is letter D, sterilization. Why sterilization? Simply because, class, from the hepatitis B infection, ano na yung next natin? Kasi yung next natin dyan is yung lahat ng gagamitin ni reservoir ay i-sterilize mo. Kasi remember, papasok yan sa portal of exit. Okay, sa portal of exit, saan ba nanggagaling ang virus? Ang virus ay probably through the bodily fluids, specifically sa blood. So there could be a possibility na yung bodily fluids, paano kung may mga open wound or sores and there's bleeding. Even mga tooth mga tooth decay na open and they cause the bleeding while having the brushing of teeth. So may mga pwedeng ganun kasi. Although we have the oral antibodies and immunoglobulin that may kill it, pero on the point that if the person is using specific utensils and possibly may have the infection, sterilization could break the chain. However, not naman at all times for those who may have hepatitis B, sterilization lang ang makakapag-break ng chain. It's on the possibility pa rin of the immune system of the person who is a reservoir already. Tapos pwede rin naman na hindi naman 100% kasi it may depend dun sa test ng patient who may have hepatitis B kung highly contagious siya. So there could be a natural antibody pa rin para to prevent even mag ano siya, even for example, nag-share siya na nag-participate siya sa blood transfusion, infected siya. So pwede 'yon kasi pwedeng ang portal of exit kasi is through blood. So I think we have a question in the chat box. So a question, clarify po if identified po yung pathogen, either microbial or viral. Okay. So very good question, very good question. Okay. Kasi if you considering antimicrobial stewardship, antimicrobial stewardship could be different from antimicrobial treatment, okay, or management. Kasi pag antimicrobial stewardship, it will be used as prophylaxis, preventive, okay, preventive management. Pero pagka antimicrobial management na, this is the specific drug that can be given to a patient with the hepatitis B virus. However, ang hepatitis B ay cannot be treated by antimicrobial. Okay? It cannot be treated as for now. There is no specific treatment or any antibiotic because it's viral, although microbial siya, generic. Okay? Any antibacterial or antiviral may treat hepatitis B. So probably it's very important if the person who may have this must be responsible and have the discipline not to consider from the portal of exit until to the next chain of infection. Okay, next question po. Okay, I think that was the last. So I will have the transition to the other topic that we may have. So do you have any question from the chain of infection or topics discussed on the chain of infection? You may raise your hand or put it in the chat box. Okay, hearing none. So I may proceed to the next topic, which is related to diagnostic examination. Okay. It is very important for all of us to consider the confidence that we may have when it comes to diagnostic examination, because it will really definitely guide us on how the nurse will have the confidence on the appropriate care management. Although there is also diagnostic examination may just be only on a working impression because it's primarily the one that had been considered as a result, but it will still undergo a succeeding examinations during the time of hospitalization so that to validate the exact disease, confirmed disease, the definitive disease that the patient had. So when we talk about, there are two terms that we may associate with the diagnostic process: diagnosis, and the other one is diagnostic examination. So if we say diagnosis, if the person have already signs and symptoms, laboratory tests are very important to identify the specific disease. Even though as nurses, we will perform vital signs, we may perform initially physical examination. These findings can be used for the data that may support specifically laboratory tests that will be indicated for that certain condition. And that as validated by the findings of the observations, interview, and physical examination findings, and even vital signs. So laboratory tests can lead us to an initial definitive direction on how we will manage the patient. So if we say diagnosis or diagnostic examination, this will facilitate specifically an examination, obviously. So from the diagnosis, it will identify the specific disease. So what could be the measure to identify the specific disease? So moreover, this is more on the diagnostic examination. This may facilitate to determine the condition, the specific organ affected, and the disease that had been possibly identified. Why possibly? Why possibly identified? Because this could be considered initially if you have admitted or attend to a client in the emergency room. This could be a primary result. Primary result, but for further testing, it may depend on the results of the initial diagnostic examination. Kaya sometimes we have doctors who may have, okay, you may have later after 6 hours you may have a repeat examination. For example, complete blood count. You may have a repeat urinalysis. If the patient had the initial results, moreover there must be a treatment that was done to the client, and to facilitate monitoring of improvement, then another diagnostic examination will be done of the same examination, so that to have comparative. So it's more on the baseline and comparative if the patient had improved. This could be also a basis wherein when we identify the periods of disease, di ba, we have incubation, prodromal period, period of illness, period of decline, and convalescence period. The diagnostic examination from the time that the person had already been exposed and as in the incubation period. Pag incubation period pa lang, ayan, nasa infectious agent level, confirmatory, the patient will be subject for the test. But during the incubation period, if ever the client had been identified with positive results, then the patient will definitely be subject for treatment. And for the clearance of the client, when it comes to the health condition or specific diagnosis, then this may pertain to if the client is already cleared or on the stage or period of convalescence. So these are the importance of why knowing diagnosis. Sir, do diagnosis only be associated with doctors? No, we have our own nursing diagnosis. For nursing diagnosis cannot just only be for doctors, because sometimes we may have this misconception. Diagnoses are only for doctors. No po. Nurses may have also diagnosis. May have the diagnosis. But on the perspective that we have the list of nursing diagnosis that can be used. So for the doctors, they do have also the medical diagnosis that they can also use, which may be subject or which may be utilized on the treatment regimen. Tayo naman for the nursing care management or nursing care plan. Why do we have the what we call nursing diagnosis? So now let us now proceed to the importance of diagnostic test parameters. There are four. Okay, there are four importance of diagnostic test parameters. Actually, as what I have mentioned, the direction talaga of why individuals are subject for diagnostic tests is, for example, if the person already verbalized symptoms, and if the person will verbalize that this is unusual, this is definitely an unusual response of the body, then the only that will give you confidence to best explain the health condition is through the diagnostic exam results. Okay. So when it comes to the diagnosis, so it may as Matt I have mentioned, this may specify the disease. Okay, the disease, the disorder, the specific illness. So it's definitely a process. Why it's a process? Because it may have definitive diagnosis. It may not just only have once that the person had been tested. There could be the second and the succeeding turns that the patient may have the diagnostic test. And this is for purposes of the monitoring while the patient is having treatment. So another is when we talk about diagnosis, it will give us direction on this more specific, or it may exclude possible illness. Kasi when you will admit a patient in the emergency room, most of the time we will set the patient to either yung mga basic diagnostic examination, X-ray, complete blood count, urinalysis, fecalysis. Kaya that's why even in medical examinations, ECG yan. 'Di ba usually in the medical clearance, these are the common examinations that are being tested simply because to identify first and foremost specific disease. And if there are findings also, for example, in the complete blood count, the basic components of the complete blood count is the RBC, the WBC, and we have the platelet. So, if for example, the client's WBC is elevated. So, if it is elevated, most of you definitely will answer me it's the patient may have infection. Pero it's not always infection. Increase in the WBC may cause the possibility of problem with inflammation. Possible din na ang patient with too much elevated ang WBC, possibly the person may have also leukemia. So these are pwede ring ang too much increase in the WBC is caused by medication side effects. So those four that I have mentioned, once the patient will undergo diagnostic examination, we could exclude, for example, okay, it's not from the medication side effects. Okay, it's not from the infection. Okay, definitely it's not from leukemia. So what is now that is remaining? The one that is remaining is related to inflammation. So now it gives you the direction that the management could be inflammation, and further testing can be done. So the further testing can be done. That's why when the patient received the appropriate treatment, the patient can have also the healthcare team can have also other parameters to validate inflammation problem. So that's like for the WBC, we have also differential count. So sa differential count, we have the basophils, neutrophils, eosinophils, monocytes. So these are differential counts which basically may identify if it is really a problem with inflammation. So the patient may not just only have one test. The patient can still have further tests, at from the initial diagnosis that the patient may have in the emergency room, pwedeng it could be revised, it could be changed on the next day due to the results of the diagnostic examination. Other than that, this may also redirect the treatment or realign the treatment based from the findings. So first, when it comes to the importance of diagnostic test parameters, we have to identify the specific disease. Number two is diagnosis, okay, which may include possible illness. Third is appropriate treatment. Fourth is to have further diagnostic evaluation. Okay, number two. Number two is other than the diagnosis, we may have the monitoring. Okay. Usually, for diagnostic test parameters, we take into consideration some of the diseases that are chronic, and second, some that are comorbidities, some that are uncontrolled. Okay. So what do we mean by that? There are some situations na when a person had been diagnosed, it needed to be controlled. It's either by dietary, by medication, by change in lifestyle, or a specific therapy. If so, can you give an example of mga chronic diseases na we need to control? Can you give examples?
Hypertension po.
Very good. Hypertension. So once the patient had been identified with hypertension, Kung controlled siya, there are few drugs that the patient may have. But once the patient may have a problem with hypertension and at the same time identified that has a direct problem with the heart, so expect the patient will be managed with pharmacological treatment na yan or management as a maintenance drug throughout his or her life for control. Other than the hypertension, can we have other examples of yung mga diseases that have been identified to be controlled? Na may need monitoring so that anytime pag ito po ay tumaas or it may cause elevation, it could be threatening to the patient. So it's already in the screen. Okay, Harold.
Diabetes mellitus po din.
Correct. Thank you so much. Diabetes mellitus, the problem is the level of insulin. So the pancreas are not sufficient or the islets of Langerhans are not releasing sufficient insulin to manage the blood glucose. Ngayon, what is being monitored? What is being monitored? Blood sugar level. Kasi anytime a patient who may have diabetes mellitus, either if the person is taking a drug, either may experience hyperglycemia or sudden hypoglycemia. So this usually happens to a patient with diabetes. Another, those who are dependent with insulin. Moreover, they may need further monitoring so that to facilitate the control if insulin is still be necessary. Kasi once the patient will be receiving insulin tapos the blood sugar is low, ang patient mo pwedeng mag-lead into hypoglycemic shock. And that is definitely very important when it comes to monitoring. So most of the time they need to monitor pa yung blood sugar level. Ito yung mga tinatawag nating RBS, yung mga random blood sugar. Kasi random blood sugar is different from fasting blood sugar. So the random blood sugar, whether the client eats or the client have not taken the meal, random blood sugar yon. Pag fasting blood sugar, the patient may have the fasting for 8 to at least maximum na yan 12 hours, pero most na 8 hours siya. So that's a different preparation, but the purpose of it is to direct a concern with diabetes. Pero once a patient had been identified with diabetes, so we need to control the blood sugar level. So ano pa yung mga specifically kailangan na i-control na ang treatment niya continuous na? How about kidney failure? How about kidney failure? Di ba pag mga kidney failure po, usually they are subject na for dialysis. So routine na yung dialysis niya. So these are the individuals na ang mga persons with kidney failure related yan sa RBC regulation. So that's why when there's a problem with kidney, chances po na ang person ay could be high risk for anemia. So that's why every now and then the patient will be checked with the RBC level of the complete blood count. And thus, there are some situations that the patient who have kidney failure will be subject for blood transfusion kasi nga this has the direct association with the level of the blood, specifically the red blood cell of patients with kidney failure. Another example pa na kailangan i-control. Example, for example, cancer. Okay, di ba sa cancer naman, for monitoring purposes, patient may have chemotherapy. So if the patient may have the chemotherapy, anong kailangan i-control? Ang control, if the patient has been diagnosed with the, stage 1. So there's a need to control to proceed sa stage 2, stage 3, stage 4. So ano yung ginagawa? For example, the patient will be subject for 6 series of chemotherapy. After the 6 series of chemotherapy, from the baseline, the patient will be subject for another diagnostic test if controlled yung specific type of cancer. So these are usually mga chronic diseases po ito na cannot be cured. However, it could be supported by a specific therapy so for purposes of monitoring. Another reason of why we do consider for monitoring is to prevent complications. Kasi if we will not monitor this through the diagnostic test, pwede kasi that chances that this may cause the possibility of existence of high risk of infection. So, I have a question din, bakit po may cancer patients na namatay even ayan, and declared cancer free? Okay, plus may mga situations kasi na ang na-evaluate when it comes kasi ang cancer most to be considered na cancer free ay nakafocus doon sa specific organ that had been diagnosed with cancer. Pero situations na may mga instances na very minimal pa lang na nag-metastasize na siya sa other organ. And sometimes yung metastasis pa niya or yung spread pa ng cancer cells niya dun pa sa mga very crucial organs na pwedeng mabilis ang transition or pacing of metastasis. Example, for breast cancer, even though the patient undergone mastectomy, continuously minomonitor yan kasi highly nodular. So yung extent ng nodes sa breast may be connected to the nearest organ adjacent to it is lungs. Sa lungs, highly nodular din ng lungs. So, pwedeng mabilis mag-spread yan sa lungs po. So, pwede kasi at the end, even the patient undergone chemotherapy, so nakikill naman niya yung mga cancer cells, pati yung healthy cells. Kaya, sometimes if the patient is experiencing immunocompromise because of the chemotherapy, may mga cancer cells pa rin na hindi pa, cancer cells are very passive that had already rather metastasized to other organs. Then afterwards, tingnan nyo, from that perspective, sasabihin cancer free pero meron na di-discover na naman ulit na metastasis na very minimal at doon naman dumami yung cancer cells. So these are the second importance of having diagnostic parameters. Next po, screening. Okay. The purpose of screening is syempre for protection of the others or healthy. Okay? Screening could be also done to specifically identify kung for example, a community is healthy. But how can you say that the community people are healthy? So let us now have the screening. So this could be, ang screening kasi could be in a large group so that it could determine who among the people in the community could be high risk of spreading infectious disease. Okay, who are carriers, who are reservoirs, and reservoirs of the infectious agent. So as we have identified it, although the primary purpose of having this screening is for diagnosis, but taking into consideration also na, for example, if you can still remember during the time na we've started the pandemic way back March 2020, March 2020. The symptoms are flu-like. The symptoms are just like upper respiratory tract infection. Pero the major yung major observation, why very sudden yung death. Tapos very sudden yung very immediate yung spread sa people. So those are the findings. Kung pneumonia naman ito, kaya that's why they started with diagnostic examination of X-ray. So, di ba dun sila nag-start, wala pang RT-PCR, wala pang antigen test, wala pang saliva test. And during the time of the screening, ang pinangahawakan lang to initiate yung chances of infection if the person already have pneumonia through the chest X-ray. So kung clear ang chest X-ray, then eventually you're clear from COVID-19. Pero kung may signs and symptoms ka, wala pa rin confirmatory test until it came out after months na UP already developed this test and even available from the other countries that have been imported to us. So yun, nag-identify na tayo ng mga test kits so that to identify the mass screening. So before, kaya if there are new types of disease that could be endemic or pandemic, ayan, test kits are very important. Pero pag wala pa siyang test kits, ang tinitingnan mo ng perspective is ano yung common. Since respiratory tract ang affected, what are the common diagnostic examinations to determine abnormalities among that population group? So kung yun ay within the population, then all of them will be tested. Kasi di ba nga it was reiterated na okay, if one of the members of the family is already confirmed, so all of the family members by the rural health unit will subject for testing kasi nga close contact sila. Even though they do not have the signs and symptoms. Next po, we have prognosis. Okay, so what's the difference between diagnosis and the prognosis? When we talk about the diagnosis, it will give you the picture of the existing health problem of the patient. Now, the prognosis or diagnostic test can give us results of the possibility if the chances of the patient of the chances of the patient to recover, of the chances of the patient to have complications, and of the chances of the patient to still proceed on the next phase of treatment. Yan po yun. Kasi kung for example, if the patient was diagnosed with stage 4 of a certain type of cancer, what is the prognosis? If the client will be subject for a therapy, then the patient may encounter on a stage 4, it already spread to the adjacent organs or major organs, there could be a possibility of further immunocompromise and it may lead to the sudden death of the patient. So that's why for the purpose of prognosis, that patient will be given only mga palliative care and pain management na lang, but not merely focused na on the treatment of the specific type of cancer. So yun yung prognosis. Another is if the patient was identified and diagnosed with the specific type of cancer, ang prognosis niyan based from literature, what are the common organs na usually it metastasize. So that's why you need to monitor, for example, if a patient has a breast cancer, or monitor if it metastasizes sa lungs. So check the function of the lungs. Of kung if the problem is basically on the problem with the, for example, sa ano naman, sa lungs, sa tuberculosis. Sa tuberculosis naman, ang tubercle bacilli pwede mag-travel yan through the circulation. At kung maging ang complication yan, pwedeng magpunta yan sa spinal, okay? And next po, pwedeng mag-cause yan ng TB of the bone. So TB of the spine. So pwedeng siyang pwedeng mag-travel yan other than with the lungs. So, din kindly explain further the difference between screening and prognosis. Okay, so ganito po. Pag if we say screening, the screening is that of we do not still have we still do not have the specific we still do not have the specific diagnosis. No identified infection yet in a group or individual. So that's why the person may have screening. Kaya pag it's just similar with annual physical examination. Kasi pag annual physical examination, okay, all of the employees are healthy. Pero to support identity of those who may have comorbidities, those could be high risk of developing complications, those could be high risk of infection. So, doon na tayo magpo-cause ng screening. So, this could be in a large group. So, no diagnosis yet. Unlike for prognosis, individuals or groups have already diagnosis. Okay, existing diagnosis, and that would be the basis of the future condition of the client. If the client will be subject for another test, if for example nga, the patient, for example, one example that I have mentioned is diagnosed with cancer, what would be the prognosis? Check the literature of what are the common metastasis of organs in the body. Then, if the patient will be subject for testing, kakayanin pa ba niya yung next session of chemotherapy, or if it's still essential, if it is stage 4. So another is for prognosis. Another example for prognosis, the patient has chronic kidney failure. So pag sinabi natin chronic kidney failure, the extent of damage to the kidneys can be managed rather through a transplant, or dialysis can be, but a transplant could be more efficient and effective as a surgical management. Pero the next question is, what could be the prognosis if the patient has the chronic kidney failure? If the patient will undergo the transplant, can the patient can sustain yung health niya in spite of even having a transplanted kidney? So yun yung prognosis. It will give us the future perspective or picture if the patient can still recover or if the patient can proceed to the next phase of treatment. So usually pag mga prognosis yan, mga genetic tests are also very important kasi yung patient's predisposition. Example, it runs through the family ang problem with hypertension. Kung if it runs to the family ang hypertension, una iisipin mo, sige, i-screen ang buong pamilya. So pagpalagay natin si ang parents mo ay may history ng hypertension. So anong i-screen? Ang screening ngayon sa mga anak. So next po, dun sa siblings. Kung isa doon ngayon ay merong hypertension, 4 of the siblings have 1 hypertension, ano ngayon yung prognosis? So that's the time na diagnose yung isang sibling, ang prognosis o ano yung chance, ano na ba yung level of hypertension mo. So the patient or the person who have been identified with initial diagnosis of hypertension will undergo series of tests compared to the other 3 who had not been diagnosed or with signs of hypertension. So I hope I have cleared my response with the question. Okay, now to proceed po, siguro I will maximize the 15 minutes up to 6:45 so that the other 15 minutes will be your health break so that you will be going back at 7 o'clock for the quiz. Okay, so let's have the complete blood count. Okay, for the complete blood count, we have the group of tests that evaluate and usually components of blood. We have RBC, the red blood cell, WBC, white blood cell, and the platelets. Now, the RBC are usually our parameters that are considered as a basis for the oxygen level and the capacity of the blood to carry oxygen through the presence of the hemoglobin and the hematocrit. So, hemoglobin is to measure yung oxygen carrying capacity, and dun sa hematocrit is pertaining to the volume. Okay, volume of blood. So obviously pagka ang patient po natin is experiencing anemia, then expect also that the patient also specifically identified. Okay. The specifically identified with the low hemoglobin, meaning low oxygen carrying capacity, at low din ang hematocrit kasi less ang volume. Kaya usually those who may have anemia are subject for blood transfusion kasi nga low volume low volume. Pero not all anemias pag mababang RBC are related to it kasi meron tayong tinatawag na sickle cell anemia, iron deficiency anemia, anemia that is caused by folic acid deficiency, anemia that is caused by the B12 deficiency. So nutritional ang cause. Yung isa, yung sickle cell anemia, ang cause niya yung decrease in the number of production of RBC. So magkaiba siya. Pera pa yung thalassemia. Yung thalassemia is a genetic disorder that usually decrease or it interrupts or it causes the cessation of production of RBC that leads the patient to signs of bleeding. So those are the aspects that we may encounter na if you carry this knowledge and you attend to the specific results of complete blood count, it will give you confidence. So just like for the WBC that I had mentioned a while ago, with the white blood cells, we can consider po if chances of infection, chances of inflammation, or leukemia. So what could be next if there is a problem with WBC? For platelet naman po, this will give us the perspective of chances with the possible bleeding because the platelet are responsible for clotting. So let us now proceed on the complete blood count. If we say complete blood count, the doctor may say, okay, complete blood count with differential count. Oh, so what does it mean with differential? If complete blood count with differential, this will pertain to CBC or rather RBC or RBC for example, na meron siyang differential. So meron tayong mean corpuscular volume, MCV, at saka yung RDW, yung RBC differential width. So doon sa doon sa aspect na yun, it added the two other than with the RBC hemoglobin hematocrit. So other than that, for example, WBC, pag may differential count siya, it will add the other results such as basophils, neutrophils, eosinophils, monocytes. So those are for the differential count. Usually, for the complete blood count, it is extracted via the peripheral blood. And usually, the tube that are being used are lavender tube. So that's the tube that is being called po on the container. And it has the what we call anticoagulant EDTA. So why this lavender tube has this anticoagulant? Simply to avoid the clotting. Kasi once the blood have clotted, it may not be useful anymore or qualify as an acceptable specimen for microscopic evaluation. So, usually, kaya nakalagay siya dyan, no, it should thoroughly mix kasi the tube has the anticoagulants para mag-prevent ang clotting. Kasi as a normal mechanism or response ng body natin, di ba, pag may bleeding, it always comes with the clotting. So parati yan magkukos ng clotting to stop the bleeding. Kaya once ang blood had been exposed, extravascular na yan. Okay, extravascular na yan. So pag na-extract na yan, may chance po yan na mag-cause ng clotting. At once ang unacceptable specimen na po, once it clotted na yan at more than 48 hours na po yung specimen, this may not be useful anymore. So why nurses must be aware of this? Kasi there are some instances that the nurses are having trainings as phlebotomists, and even in the absence of the medical technologists or the laboratory scientists, if the nurse are trained accordingly to extract blood, the person or the nurse can have the specialized training on it and certified to have services or performance of procedure. So it's very important kasi yung extraction, and it's very important pa rin yung collection of specimen. And part of our role as nurses also is yung collection of specimen. So let us now proceed with the red blood cell. For the red blood cell, it is called as erythrocytes. Usually, ito po, sir, saan po na po-produce ang red blood cell? Red blood cell are being produced sa bone marrow, pero nagmamature siya saan? Nagmamature po siya sa bloodstream. So these are the two aspects. Ang maturity niya sa bloodstream, ang production niya sa bone marrow. Kaya pag may problem sa bone marrow, may problem sa bloodstream, pag bone marrow, may magkaka-problem with production of RBC. Pag sa bloodstream, magkakos ng problem with the maturity of the red blood cell. Usually the span of the red blood cell is lifespan niya ay 120 days. Okay, 120 days ang lifespan. Now, what are the components of evaluation for red blood cell? The reference po natin for red blood cell ay 4.5 to 5.5 million. Okay? So later on, how about if the result, sir, is less than 4.5, and how about if the result is higher than 5.5? So later on, we will have those interpretation. So we may have the total red blood cell count, we may have hemoglobin, we may have hematocrit, we may have mean corpuscular volume, and red blood cell distribution width. Okay, I stand corrected. It's not red RBC differential width. It's red blood cell distribution width, or RDW. So these examinations are very essential kasi lalo na yung mean corpuscular volume at red blood cell distribution, because it will give us further information to specifically direct yung treatment or focus natin when it comes to care management. So let's start with the hemoglobin. We have mentioned po sa buong RBC, almost 90% of the component of the red blood cell ay hemoglobin. Yung hemoglobin concentration po ay usually, as for the 90%, is yung capacity of the blood or the red blood cell to carry the oxygen. Kaya that's why this is a very important component. Although, sir, ano po yung pulse oximeter, ano pong dinedetect niya? It could detect yung peripheral, pero specifically yung actual through the hemoglobin level, it's through the serum or blood. So what is our interpretation if we have decreased hemoglobin and we have increased hemoglobin concentration? Pag decrease in hemoglobin concentration, the term that are being used is anemia. For increase in hemoglobin concentration, we have that's polycythemia. So it lacks Y. Polycythemia. So Class, this is referring pag hemoglobin concentration, sometimes you may encounter hemo concentration. So yung hemo concentration yan, yung blood concentration. So for hemoglobin concentration, obviously pagka decrease in hemoglobin concentration, decrease ang hemo concentration. So kung increase hemoglobin concentration, there is definitely increase ang hemo concentration. Now, these are the findings that we may have kung for example po we are talking about hematocrit. For the hematocrit, it usually measures the total blood volume that made up the red blood cells. That's why when we talk about the hematocrit, most of the time they will mention about volume. Kung sa hemoglobin, we're talking about oxygen. For hematocrit, we're talking about the volume itself, the total blood volume that made up the RBC. So pwede siyang identify if it is hypovolemia or hypervolemia. So usually, if kung ang result po ng hematocrit concentration ay decrease, so eventually loss of blood. So pag sinabi nating loss of blood, it is true, for example, kung it is caused by stabbing, okay, stabbing, internal bleeding, pwedeng gastric ulcer that leads to gastric bleeding. Pwedeng yung menstruation pero profuse bleeding. Miscarriage or abortion na profuse ang bleeding. So expect po natin that these are the possible considerations na we will really need to check the hematocrit. There are also findings for decreased hematocrit concentration when it comes to nutritional deficiency. So pag sinabi natin nutritional deficiency, ito na po yung may problem sa iron, sa vitamin B, at saka sa folate. So class, remember, if you can still remember in your obstetrics, okay, in your maternal nursing, that most of the mothers experience iron, vitamin B, and folic acid deficiency because aside from the maternal circulation, ang source ng circulation ng fetus are from the maternal circulation. So what happens to the maternal blood? So yung maternal blood mo nag-expand. So once yung cause ng expansion nito ay ito po yung nagiging result. So that's why they are being given with supplements, okay, by the obstetricians. Another is you need to specifically identify pag nadidinig niyo yung iron, vitamin B, folate, nutritional deficiency ang problem dyan. So kung ang problem naman po is talagang anemia that is caused by abnormal hemoglobin. So mababa talaga yung sobrang baba ng hemoglobin. So usually ang concern dyan ay sickle cell anemia. So if we have abnormal hemoglobin. So next po, if we have increase in the hematocrit concentration, usually ang volume niyan, ang volume expected mo, pag highly concentrated dyan, the blood is highly viscous. Kaya ang term dyan is wrong spelling na naman, polycythemia rubra vera. So if you have heard this term, the viscosity of the blood is highly viscous. At another is, there's a drug that whenever there is a problem with the chances of bleeding or anemia, erythropoietin is one of the drugs that are being given. Usually these are given intramuscularly. It is also in a pre-filled syringe that is readily be administered to the patient. However, kung nag-abuse naman, okay, abuse of erythropoietin kasi 'di ba to prevent bleeding. Kung nag-abuse naman ng erythropoietin, ang problem naman yan magka-clot. So magi-increase yung volume ng blood. So this may cause a possibility of problem then with the obstruction. So I think time check, we are already 6:48. So probably I may stop here so that we may have the time for you to prepare and to check your Neo LMS. I'm having high energy pa to continue the discussion, but we may still continue on Friday. So we may have first a health break and be back po immediately 5 minutes before 7 o'clock because the exam are already open at 7 o'clock. So we may have 20 items so that we could still manage those who may have problems with Neo LMS. Thank you very much.